Hi, everybody, and welcome to our webinar. The topic is Overcoming the Fear of Vomiting. Ken Goodman, who is licensed in clinical social work, will be explaining the pervasive nature of emetophobia, or the fear of vomiting. He will talk about this vicious cycle which keeps sufferers trapped and the strategies for conquering this all-consuming fear. My name is Suma Chan. I'm Professor and Director of Cognitive Behavior Therapy Program in the Department of Psychiatry, St. Louis University School of Medicine. And I'm a member of the Public Education Committee for the Anxiety and Depression Association of America, that's ADAA. Before we start, I'd like to say a little about ADAA, or the Anxiety and Depression Association of America. ADAA is the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education like this webinar, practice, and research. We work to end stigma and to get the word out that these conditions are real, they are serious, and treatable. I want to invite you to visit the ADA website. It's an excellent resource. That's adaa.org. You'll find a great list of treatment providers there, as well as a free peer-to-peer online support group. And you can support ADAA by making a charitable donation on the website. Okay, so let's get started. I'm really happy to introduce our presenter, Ken Goodman. He specializes in the treatment of anxiety and obsessive-compulsive disorder. In his practice in LA, he works with anxiety sufferers of all ages to help them find relief and freedom from debilitating fear and anxiety. He lectures at universities and organizations including USC, and also the annual conference for the Anxiety and Depression Association of America. He has authored and produced the Anxiety Solutions series, Your Guide to Overcoming Panic, Worry, Compulsions, and Fear, a 12-hour self-help audio program, as well as Stress-Free, a compilation of 6 relaxation exercises. Ken earned his bachelor's and master's degrees from UCLA and was trained in clinical hypnosis from the UCLA Department of Psychiatry. Without further ado, let me now turn it over to Mr. Ken Goodman. So over to you, Ken.
Thank you for that introduction, Suma. I'm very pleased that ADAA invited me to speak on this phobia, which is much more common than people think. And let me just say from the outset that no one likes to throw up. I'm hesitant to even say those words because many who suffer with emetophobia cringe or feel anxious just hearing it, but you really can't teach people how to overcome emetophobia without saying the words vomit or throw up sometimes. So I encourage you to stay with this webinar, hang in there despite your feelings so you can take the first steps towards beating this fear. And like I said, no one likes to throw up. Everyone is disgusted by vomit, but you will notice that as you hear and see the words more and more, you will get used to them, and at some point, those words won't upset you anymore. It's like getting acclimated to a cold swimming pool. The best way and the quickest way is to jump in and move around, and eventually your body acclimates and you warm up. The temperature of the pool does not change, but your body gets used to it. So with that said, let's jump into the material to help you conquer your fear of vomit. So what is emetophobia? Well, it's essentially a fear of vomit. It's different from other phobias in that it can be very pervasive. When I think of other phobias, let's say glossophobia, which is a fear of public speaking, or claustrophobia, fear of closed spaces, people afraid to get into elevators, or someone has a fear of snakes. People only feel anxious in those situations when they're encountered with the snake or the elevator or the public speaking. Otherwise, they're okay. With emetophobia, it's very pervasive, and it can consume a person from the time they wake up to the time they go to sleep. The reason why I'm doing this webinar is sometime earlier in the year, I wrote an article or a blog for the ADA website, and it actually got a lot of response.
Yeah, that's right. I think it was quite surprising that, people really were so interested in that topic, because maybe people don't talk about it as much, but definitely it is there, because I think your blog post received pretty much more comments than many of the other blog posts on the ADA website. I think there were more than 90 comments there.
Yeah, there was surprisingly, there was so much response that they asked me to do this webinar. So I thought I would start off by just reading a couple of those responses from people. And if you suffer with emetophobia, you'll probably relate to these. Hi, I'm 16. I have severe vomit phobia. I started to feel sick every day 10 months ago, but have always had the phobia. I always avoid social situations and even sleep with a bucket by my bed in case I'm sick in the night. I feel sick every day, and I think I may be sick. This phobia has messed my life up, as I had to do exams with it, and I probably failed because of it. It has made my friendships more complicated, and my family don't really understand. My mom, I guess she's British, my mom wants me to get a job, and I've told her how much I struggle to go from day to day life, but she doesn't understand. I wish this phobia would just go away. Doctor had done so much tests, but nothing has come back as an illness. I do have CBT, which helps a bit, but not a lot. Mom believes I'm throwing my life away, but it's not me, it's my anxiety and my phobia. So you can hear how pervasive this disorder can be. Here's another one. Hi, I'm not only tremendously afraid of vomiting, but I'm also afraid of the word being said. It's gotten to the point that if a kid throws up near me or even puts their hand on their stomach, I will scream and start shaking and hyperventilating. It's pretty embarrassing and scary because it's gotten so much worse. I've only thrown up once in my life. I threw up in kindergarten. I don't know what to do with this problem as it's consuming my life. Thank you so much for this article. I hope it helps. So you can really hear how much people suffer, and if you have this disorder, you know yourself how much you're suffering. So what are the characteristics of emetophobia? Well, there's either a fear of vomiting or a fear of other people vomiting. Right now I'm treating a woman who actually does not have a fear that she will vomit, but she's afraid of other people vomiting and how disgusting it is, and she becomes very anxious and worried when she thinks that other people around might potentially vomit. There's avoidance. In other words, avoiding any place where vomiting could occur. So a doctor's office because people are sick there, or a boat because of motion sickness, or a restaurant, new places, or any place where the bathroom isn't certain. There's a feeling of nausea. So the way people typically with emetophobia experience it in their body is a feeling of nausea. And there's also people feel obsessed, and they are very hypervigilant. Examples of hypervigilance might be...
Yeah, could you specifically talk about how it is sort of different in people with emetophobia? Like hypervigilance is there in people who are anxious generally, but probably it's pretty different in people who have this fear of vomit. It's more focused, right? Fear of vomiting.
Yeah, exactly. So they're constantly looking out for anything that has to do with vomit. So like looking for people who are sick. And if you see someone put their hand on their stomach, like the person with the blog post, you might watch them more closely for other signs of them being sick. Or maybe constantly looking at products for their expiration dates. Or when you enter a new place, looking for the restroom. Or, before maybe seeing a movie, you might try to find out if there's like a vomiting scene. And then people can be hypervigilant within themselves or within their own body. So scanning their body, looking for signs of nausea, taking their temperature. So things like that.
Right.
So how did I get this way? People want to know. Well, anxiety does tend to run in families. So whether it's environmental or genetic, there are both of these components present. But it usually can begin with some sort of a traumatic experience, a scary experience, or a scary thought, which turns into obsession. So maybe as a child, maybe you threw up and you experienced it as very traumatic, or maybe it was traumatic. Or you saw someone throw up, maybe a parent who was intoxicated, who was violently ill. And from that, you began to worry about it and obsess about it. And then there's a feeling of nausea. So not only do you have the thought, but you start to feel nauseous, and then you begin to worry, am I sick? Am I going to throw up? Then you become hypervigilant, where you're looking out for things, always on guard, always worrying. And then there's avoidance, where you start avoiding places. And if you start avoiding places, it just makes the phobia worse. And then finally, you can develop compulsive behaviors like hand washing, because possibly there's germs on your hand, which may make you sick and have the flu, so you wash your hands a lot. You don't have to have the compulsions, but oftentimes the other four are definitely in place. Now, what causes nausea? Well, many different things cause nausea when you think about it. Motion sickness. I can include myself in that category. Stomach flu, food poisoning, pregnancy. These are all things that cause nausea. There's when you drink excessively, you can get nauseous. Food intolerance. But there is one more thing, and that is anxiety. Anxiety can cause nausea. So you've heard of adrenaline. Suma, let me ask you a question. Do you know what the nickname for adrenaline is?
Well, all that I know is that it's released when we are very afraid, fearful, highly stressed. So I guess it has something to do with that.
Yeah, they call it the fight or flight hormone. It's for emergencies. So let's say you see a fire. Your brain will then signal the adrenal gland. There's two adrenal glands above the kidney and the kidneys. And your brain will signal the adrenal gland. The adrenal gland will secrete adrenaline. It'll make you fast and strong so you can run from the fire or put it out. That's why they call it the fight or flight hormone. It's for emergencies, and it is a necessary and vital hormone. However, adrenaline also causes symptoms of anxiety, like difficulty breathing, tightness in your chest, racing heart, sweating, lightheadedness, diarrhea, as well as nausea. It's very predictable. It's like, what would happen if someone drank too much coffee? Let's say 5 cups of coffee. What would happen?
Are you
What would
asking
happen
me?
to them? I'm asking you, what would happen if someone drank excess amount of coffee?
Yeah, typically you start feeling very hyper alert, increased heart rate, a little sweating.
Right, like that guy, right? You get kind of jittery and restless. And what
Yeah.
would happen if someone drank too much alcohol? 5 shots of tequila, let's say.
Wow, let me think of the last time I did that. Just kidding. Okay. So I guess you'd start feeling sort of woozy, a little drowsy, start
Yeah, like,
tottering all over, slurring of speech.
yeah, exactly, right? So depending upon the substance that you put in your body is going to react accordingly. Well, it's the same thing with adrenaline. You're just not drinking it. It's happening all internally. It's as if you took 5 shots of adrenaline and now you're feeling nauseous, right? It's, it's just because your brain is signaling your adrenal gland. Now, the brain's amazing. It calculates thousands of things all at the same time, but it's similar to a computer in that it does what it's programmed to do. So if someone, let me ask you this, Uma, if someone reprogrammed your computer 2 plus 2 equals 5 without your knowledge, what would
Right.
happen if you push 2?
Yeah, of course it would show up 5.
Right, so even though it's wrong, that's what would happen. Well, it's the same thing with your brain and your imagination. If your imagination tells your brain something scary, like, I think she has the stomach flu, what if I get it? Your brain is going to signal your adrenal gland to secrete adrenaline. So here's the flow. Imagination says something scary, brain signals the adrenal gland secretes adrenaline, and suddenly you're feeling nauseous. So when your anxiety says things like, oh my God, you're nauseous, what if you throw up? It's going to be so embarrassing, you're sick, don't go, you stay home. Your brain will signal the adrenal gland, right? So there's a vicious cycle that takes place with emetophobia. And it's difficult, it's very, very difficult to escape. It may start with an external trigger of some sort.
Kent, I think it would be good if you could give some examples of these external triggers. I'm sure many of our listeners would be aware, but each person might have their own trigger, which is different from that of somebody else. But I'm sure people with phobia have some typical triggers, right?
Right, like the person that did the blog post, she had a trigger of someone putting her hand on her stomach, and that sort of triggered her worries. Let's say going to a movie and if there's a vomiting scene in the movie, or even wondering if there's going to be a vomiting scene in the movie, or someone telling you that they think they're sick or that they threw up yesterday, or even having a sip of alcohol or being around other people who are drinking. So all these things are triggers. And then once you get the trigger, you start to worry. And once you worry, you start to feel nauseous because remember your brain is signaling your adrenal gland. And then once you start to get nauseous, you get more worried and more nauseous. And then you start to avoid. And once you avoid, your anxiety begins to come down, right? Now, the same cycle can start with nausea. In other words, you don't have to necessarily have a thought per se. You could just start to feel nauseous. And just feeling nauseous will set the cycle in motion of then getting worried, feeling more nauseous, and so forth. So people tend to avoid. When you have any sort of anxiety, you tend to avoid. And the same is true with emetophobia. And the more you avoid, the more the problem worsens. And not only that, but the more you avoid, the more your world seems to shrink, where you stop going out with friends, stop going out with family, and life can become very, very depressing. Here's another cycle. Remember, you're trying to protect yourself. You don't want to throw up, so you want to try to protect yourself. Well, how do you do that? You become hypervigilant, looking out for things that might trigger it. Now, if you're hypervigilant, trying to protect yourself, it means you're chronically worried. It means you're worrying all the time. And if you're worrying all the time, your brain is signaling your adrenal gland, which means you're going to be nauseous a lot. And if you're nauseous a lot, you're going to be very anxious. And if you're going to be very anxious, you're going to try to protect yourself. So it's just this horrible vicious cycle that is extremely difficult for anyone with emetophobia to break from. So the effects of adrenaline are not only predictable in that you feel nauseous, but they're also idiosyncratic, meaning each person with anxiety experiences that anxiety differently. So for instance, I have patients who experience their anxiety in their chest, maybe in the form of tightness in their chest or racing heart. I have patients who feel lightheaded. They don't feel nauseous, they don't have the racing heart, but they feel lightheaded. I have patients who sweat. They don't have the racing heart, they don't have the dizziness, but they have the sweating. There's other patients who experience it in their stomach. They feel maybe stomach pain, they have diarrhea. So these people experience it different. Now you could have a combination. Some people have the lightheadedness and they also have tightness in their chest. But sometimes it's very, they just feel one or the other. But it's the same thing with nausea. It affects your stomach. So sometimes people will come in and the only physical symptom they really get is the nausea. So the good news for emetophobics is if you're anxious, if your anxiety caused you to feel nauseous, but you never vomit, you won't. Because, I'm sorry, you're going to say something?
No, I was just going to say, it's sort of a bit odd that, they almost never vomit, but they still fear it so much. Isn't that right?
Oh, yeah, very, very much so. I'm going to get to that in a moment, but you're right. They rarely vomit. In fact, most people that I treat say, oh, yeah, I vomited a couple times. Once I had the flu, once I had motion sickness, but otherwise they rarely ever vomit. And that's because they don't experience, vomiting is not part of the way they respond to anxiety. I had one patient that I treated that when she became anxious, she did vomit. But that's how she experienced it. The other patients that I treated with nausea, that's all they experienced was the nausea. So it's very specific. If you don't vomit because of anxiety, you won't. You'll just feel nauseous. So why then do emetophobics, this goes to what your point is, why do emetophobics believe they will vomit when they never do? Well, it's because anxiety is very, very tricky. So the person who has racing heart or tightness in their chest believes, oh, I'm having a heart attack. And the person who has lightheadedness thinks to themselves, I'm going to pass out. And the person who has stomach upset thinks, what if I crap in my pants? They're worried about losing control of their bowels. And yet, when I ask these people, when I ask them, well, have you ever had a heart attack? Have you ever passed out? Have you ever lost control of your bowels and had an accident? They always say no. Like it's never happened before. But that's how tricky anxiety can be. And it's the same thing with people with emetophobia. Anxiety tricks emetophobics. This time I really am sick, right? But remember, just because you're nauseous does not mean you are sick or have food poisoning. You are nauseous because of anxiety and adrenaline. But once in a while, people do get sick. It's just very rare. And that's what emetophobics get fooled about, because it is possible to get sick.
Right.
So remember when you were in elementary school, Suma, and did you ever get anxious when they had a fire drill?
Not really, because it's just a fire drill. It's not the real thing.
Right. So even though the alarm system at the building was going off, you did not get anxious. And so what's happening when people are getting anxious, their alarm system in their body is going off, but there's no emergency. So just like when you were in school, the alarm system in the building is going off, but there was no emergency. In fact, your teacher would say, okay, we're having a fire drill, everyone please line up, and she would say it in a calm voice. Right? And so the students sort of ignored the fire drill and just focused on the calmness of the teacher. But when you have anxiety, your internal system, your emergency system is signaling, your alarm system is going off, and then your anxiety is yelling and says, fire, fire. I mean, this is what would happen what happens if the fire alarm goes off in a school and the teacher yells, fire, fire? All the kids would start to get really, really anxious because now the teacher is yelling fire. Well, the same thing is happening with people with anxiety. So their alarm system is going off, and at the same time, their anxiety is screaming, oh my God, you're sick, you're going to puke. So the combination of the alarm system going off in your body, in other words, you're nauseous, and your thoughts are saying, oh my God, you're sick, the two in combination makes it difficult to think clearly. It's difficult to think logically in that situation.
Yeah, Ken, going back to this, what we talked about, the fact that they actually will never vomit. I mean, but I think people with anxiety don't even want that 0.1% chance that it will happen, right? That's how they are typically. I don't want it to ever happen. So, often we ask people with anxiety, what would happen if you actually threw up, because they're so afraid of that terrible outcome, right?
It's horrendous.
Yeah, but the thing is that, if they actually did, nothing dreadful really happens. Because I also had this one girl who said she did, and actually when I asked her what happened, I was expecting it to be some terrible experience. Actually, she did not. It was not a big issue. People just came to know she threw up, and they were all very supportive, and that was it. Everybody else forgot about it, but she didn't. I think they make it out to be this horrible thing,
Was it horrible for her?
Well, she felt very afraid and anxious about it, and she felt embarrassed more than anything else. But beyond that, it's nothing so terrible, right? I mean, it's only human for all of us to have that kind of illness or stomach flu now and again, and you nauseous and
right.
Right.
Like I have a patient, and he has emetophobia, and his wife, every month, for a menstrual cycle, she throws up.
Right.
And she's like, oh, it's no big deal. She just throws up, and he just can't understand how she can handle it. Well, for her, it happens every month, so she's not afraid of it. But for him, he never throws up, and so he's constantly afraid of it because he never does it. He never experiences it. So what are people with emetophobia afraid of? Well, they're basically not sure when it will happen. So that uncertainty creates a lot of anxiety. So even though they may not throw up but once every 5 years, it could be tomorrow. And that uncertainty is enough to make people extremely afraid. They're also not sure how long it will last. So the patient I was just referencing, when he throws up, it's pretty violent, and he just has this worry that it's going to last for several days and how tortured he'll be. Also the sensations, the sound, the taste, how it feels, what it looks like. Some people are just more sensitive to things like that. Like, for instance, for me in my house, I may be, feeling, kind of warm, but my wife may feel cold, like she feels the temperature differently. Some people are more sensitive to sounds. Other people are more sensitive to tastes. And so I think people with emetophobia, they have sort of an amplification of those sensations where it just feels worse. It maybe tastes worse. I mean, no one likes the taste. It tastes terrible. But I think if you have emetophobia, it probably it's much worse. And then if you have any sort of social anxiety, you may feel very embarrassed. You may worry about the embarrassment of throwing up in front of people, or even in the bathroom, what it sounds like in a public restroom. Finally, sometimes people have a fear of choking. They may worry that, oh my God, I may choke on my vomit and die. And then others, they fear mostly other people vomiting or being vomited on. I remember I had a patient, she didn't have a fear of throwing up. She just worried that other people would vomit on her. So if she was in a movie theater and people were filing in and people were filing in behind her, in the row behind her, she worried, oh my God, what if they throw up on me? So these are types of things that people with emetophobia are afraid of. Now, the diagnoses can be confusing, and sometimes people get misdiagnosed. If you don't eat, for instance, like I had a 9-year-old boy who wouldn't eat in the morning because he was going to school. He was afraid if he was going to throw up in school, or he wouldn't eat lunch. He only ate when he came home. And so that might look like anorexia, where people may misdiagnose you. Well, it's not anorexia, because people with anorexia don't eat because they think they're overweight. People with emetophobia don't eat because they're afraid they're going to vomit. Panic disorder. You can have a panic attack because you're going to be going out somewhere and you're feeling so anxious you might have a panic attack. But it's not because you think you're going crazy, you're going to die. It's because you're worried about throwing up. Like I mentioned with social phobia, people with social phobia tend to feel anxious conversing with others. They worry about embarrassment. They worry they're going to say something dumb and embarrass themselves. So they don't communicate or don't socialize much, particularly when they're around strangers or people they're not that familiar with. They tend to be more quiet, but it's not because of a fear of throwing up. The people with people can sort of withdraw if they have emetophobia and withdraw from interacting with people, like maybe they cancel on people, they don't go out. It's not because they're socially anxious, it's because they're fear of throwing up in front of others and embarrassing themselves. Illness anxiety, people might get confused with that, so they get misdiagnosed. People get fear of different types of illnesses. Anxiety is a fear that they're going to have some sort of major illness. Well, the illness here is really the throwing up again. And again, people with OCD, there is a tendency to wash your hands because of germs. But with emetophobics, it's specifically about the fear of germs that will cause them to throw up. Whereas people with OCD tend to, who if they have a washing hands compulsion, tend to do that just because of germs, and they might just get any sort of sickness. It's not specifically about throwing up.
Ken, this is so true what you're saying, that how, there can be a little bit of confusion about the diagnosis, because I saw a girl and she had been diagnosed with social anxiety actually, and she never talked about her overriding fear of vomiting, and she never talked about it to the psychiatrist. So when she was referred to me, she came to me with a diagnosis of social phobia, and she talked about it a little bit later, maybe the third session or so. Only then did it come up. So sometimes maybe people are hesitant, they feel embarrassed even to talk about it,
Yeah, and people sometimes don't think they've never heard of it. They've never heard of it before. Right. And so maybe they don't even think to bring it up, which is why it's really important for therapists to ask, how people experience their anxiety. And if someone comes in the office and they feel they get nauseous, the good question would be to ask, well, do you have a fear of throwing up?
Right.
So let's talk about treatment. So, like I mentioned before, you have your thoughts, and the thoughts is you're going to throw up. The thought might be you're sick, and then at the same time you're feeling nauseous. So we got to deal with these two components. We got to deal with the physical sensations you get as well as the thoughts. So let's start with the physical sensation. So there's many pieces to solving an anxiety puzzle, and this is just one piece, but it's an important piece. So Suma, just for a moment, and everyone who's listening, do this as well. Put one hand on your chest and one hand on your stomach, and take a very slow, deep breath through your nose. And as you're inhaling, does your stomach rise or does your chest rise? Ask yourself that question. And typically, people with anxiety, not everyone, but oftentimes people with anxiety, their chest rises. Well, if you think about someone who's having a panic attack and hyperventilating, it kind of looks like this, right? So I know you couldn't see me, but if you're going to characterize that type of breathing, you would say it's fast, it's loud, it's from the mouth and the chest. So that's what anxious breathing looks like. So if that's what anxious breathing looks like, the opposite is relaxation breathing. So the opposite would be slow, silent, through the nose, and with the abdomen. That's what relaxation breathing is. It's slow, silent. And notice I wrote silent. It's not quiet. It's silent. Like you can't hear yourself doing it. With the abdomen and from the nose. Now, you could technically breathe through pursed lips. In other words, have your mouth almost closed and inhale and exhale through your mouth. However, that's not subtle. And the reason why I like people to breathe through their nose is they can do this breathing in front of anyone. So if you're at dinner or you're at work, you can do it in front of people and no one will know that you're breathing. So I teach people what I call 3x3 relaxation breathing. So I want you to follow along with me, everyone. So you're going to inhale slowly through your nose, and you're going to push your stomach out slowly. Now, if you're not accustomed to breathing with your abdomen, I want you to try this first. Just push your stomach out with your stomach muscles. Use your stomach muscles and put your hand there and just push your stomach out, almost like you're doing a stomach push-up, and let it fall back. And then push it out again and let it fall back. And if your stomach muscles are weak, I would recommend practicing this every day, just pushing it out 10 times in a row, and every day do it. And after a few days, you'll develop those muscles. So now try to gain some control. Push your stomach out slowly, and then bring it back in slowly. Forget the breathing for a moment. Just push it out slowly, and then bring it in slowly. And now you can introduce the component of breathing. So now you're going to inhale slowly and silently through your nose. And as you're doing that, you're going to inhale slowly as if you're inflating a balloon. And then you're going to exhale really slowly through your nose. Slowly and silently. Try that one more time. Slow and silent. Okay, good. Now you're going to add the component of a 3-count pause. You're going to inhale slowly, pause for 3, and exhale slowly. So try that. Okay, good. Remember, slow and silent. Now, if you're breathing correctly, but your mind is focusing on something scary, like you have the flu, you think you have the flu, or you might have the flu, it's not going to relax you. Your mind has to be focusing on something relaxing. So I'm going to give you a phrase, and the phrase is, I can relax. Now, when people are anxious, everything is going fast. Heart rate, blood pressure, pulse, breathing, thoughts. So what you're trying to do is slow everything down. So I want you to think the phrase, I can relax, in slow motion as you're inhaling and exhaling. So as you're inhaling, you're going to think. You're not going to say it out loud. You're going to think to yourself, I can. Pause for 3, and then exhale. Relax. So I call it 3x3 breathing because there's a 3-count pause, and you take 3 breaths in a row. So again, slow, silent with the abdomen through the nose. Your stomach rises on the inhale. Pause for 3 after you inhale, and you think a relaxing phrase slowly. Now, I recommend the phrase, I can relax, but it really can be any phrase. And then you're going to practice throughout the day. Oftentimes, therapists will teach some sort of relaxation breathing. And they'll say, all right, when you're anxious, just breathe. But oftentimes it doesn't work. And the reason is because the person has not been practicing it. The idea is that you practice it periodically throughout the day so that when you are feeling anxious, you know exactly what to do. Because let's face it, when you're in a state of anxiety, you probably won't even remember to do it. And if you do remember to do it, you won't remember how to do it. So again, you practice periodically throughout the day.
Yeah, I talk
So,
about it like as if you're preparing for a marathon, you know, you run every day so that when you
yep,
actually have to run, you can do it really well.
exactly. Yeah, for anything. So when someone is practicing, if they have a piano recital, they're going to practice when no one is around, when there's no stress. They can make mistakes, it's fine. So they're ready for the performance. So the amount of times that you practice is important and how long you practice. Now, I recommend 2 sets of 3 for a total of 6 breaths, and 6 breaths is 1 minute of practice. So basically, you're practicing for 1 minute, 5 to 10 times a day. And you're practicing at various points in the day. You're not just practicing for 5 minutes, let's say in the morning. I like people to practice periodically throughout the day.
You know,
And
sometimes
the
people
reason,
want to know how long they should practice it for. What do you usually tell people? 1 minute,
yeah,
5 breaths, 10 breaths?
yeah, like I said, six breaths is about 1 minute, but I would recommend somewhere between 5 to 10 times a day. Like you're practicing, you know, maybe once as part of your morning routine, once as part of your evening routine, and then you work it in another 3 to 5 times during the day. Now, you won't remember to do it because it's not in your daily repertoire, but if you leave a note for yourself, maybe in your car, in your bathroom mirror, set your cell phone to go off a couple times during the day. And,
Yeah,
the
that's a
reason
good
why I like people, yeah, because you're just not going to remember.
right.
And it's so important to be able to practice in different settings because let's face it, you feel anxious in different settings. Now, when you practice it initially, just practice by yourself with your eyes closed, but also practice with your eyes open because there's going to be situations where you can't close your eyes. Let's say like when you're driving or you're in a restaurant or you're at work. You can't close your eyes, so you want to practice with your eyes open too. With your eyes closed, with your eyes open. Once you get it, start practicing when you're not anxious, but you're around other people, and get a sense that, all right, no one can see that I'm doing this. So practice throughout the day. Another thing you could do to help with relaxing your body is to do relaxation exercises. I mean, after all, if if you want to be a calm person, you have to practice being calm. If you want to be a good typist, you practice typing. If you want to be a good pianist, you practice piano. So if you want to be the calm person you desire to be, you have to practice being calm. So I put out this stress-free download, and it has a combination of these 3 different exercises. There's 6 different exercises altogether, and basically a relaxation exercise is different from, let's say, listening to classical music or listening to soothing music or listening to the sound of the rain. A relaxation exercise is a soothing voice that's guiding you with maybe the sounds of nature or relaxing music in the background. So it's a little easier than meditation. You don't have to really think. You just sort of follow along. But meditation is great. Yoga is great. Mindfulness is great. I don't have time to go into these 3 things right now, but you can do a little research on your own. But all these things help you to learn how to relax your body so that your alarm system, the nausea, is not going off so much, and you have a way of sort of dealing with anxiety when you feel nauseous. So we have to start shifting our perspective. The shift of perspective I want you to think about is this. Instead of struggling with your anxiety, I want you to look at your anxiety in a different way, like you're playing a mental game against a clever opponent. So your anxiety is a very clever opponent, and he's trying to trick you, constantly trying to trick you. And you got to think, well, if I'm playing this game, why am I losing so much? Why is anxiety kicking my butt? Well, the primary reason is because you're only playing defense. Anxiety requires that you protect yourself. So you must always be on the lookout for potential threats. You must always avoid possible danger. Right? In other words, you're constantly protecting yourself and you're only playing defense. Right? So when people are hypervigilant, they're looking for the sounds and smells, you know, food contamination, um, alcohol. I mean, they're just looking for things. So they're just constantly on guard. But think about this, you know, in any sport, if you only play defense, you can't win. I mean, think about a basketball team. If they only play defense, they're not going to win. Soccer, if they only play defense, they're not going to win. You have to go on offense to win. So what does this mean? Well, these are sort of the components. You got to take one brave step at a time. These frequent brave steps into the territory of anxiety. You have to have an offensive mindset. You got to play to win. The offensive mindset is a bring it on attitude. You have to be clever. I mean, you're going up against an opponent that's bigger and stronger, so you have to be clever and outsmart them. And you have to be patient, and you have to be persistent. You know, you can't give up. You got to be persistent, and you got to be patient. I mean, this phobia has probably lasted a while. You can't expect it to go away quickly. So you take small, brave, clever steps towards discomfort and uncertainty, moving into your opponent's territory until you win. So again, you're taking steps towards discomfort and uncertainty. You're putting yourself in situations that you're uncertain and that you feel uncomfortable. So what does this look like? Well, maybe you begin with looking at a cartoon of a person vomiting. And for some people, that might make them feel uncomfortable. That might make them feel anxious or maybe even nauseous. But, you know, you look at that, and you look at that frequently, and you look at that over and over and over until you're able to tolerate it and it no longer is a problem. And then maybe you move on to a photo of a real person vomiting. And then once you move on to that, that's going to rise up your anxiety again. Again, you're going to feel discomfort and uncertainty. And you keep looking at that picture over and over and over and over again until that goes away. And then when you feel okay, now maybe you move on to a video. Maybe start with listening to a video of a person vomiting. That's going to start your anxiety all over again, that discomfort all over. But you keep listening to it again over and over and over until that doesn't become a problem anymore. Like, okay, I can handle it, that's fine. And then maybe you move into watching a person vomiting. Again, anxiety will rise up again, discomfort will rise up again. Do that over and over and over.
Sorry, I just, you know, often people want to know, like, how often should they do the exposure? Sometimes they, you know, sort of reluctant to do it. They say maybe I can just do it once a week, or, you know, they feel that's good enough. So could you specify for our listeners, you know, what's a good idea of how many times they should do it?
Yeah, you know, you will be very reluctant to do any of these things. People with emetophobia, fear of vomiting, just won't want to do it. It's not that, of course you don't want to do it, but if you want to get better, you need to do it. And you need to do it frequently. You know, I have a friend of mine, he's a volleyball coach for a high school team, and every time people who've never played volleyball before get in there and they hit their hand with the volleyball, hit their, you know, their wrist, it stings every single time. It hurts so bad. But after a week of doing it, it no longer hurts. They become desensitized to it. But think about how many times they have to hit a volleyball in order for it to not sting anymore. I mean, hundreds of times. So you think about, all right, I gotta do this frequently, and I gotta do this often. I don't want to do it, but I need to do it. So, you know, every day as much as possible. And here's another exposure that you can do is, again, watch and listen to a video of a person vomiting. Again, you do it over and over and over until it doesn't bother you anymore. Now, how you take these brave steps is important, because you can take the brave steps and never get desensitized to it. Like I've had patients, let's say, with a fear of driving. Yet, every day, they drive their children to and from school. And you would think with all that driving, they would overcome that fear. But they don't, because as they're driving, they're white-knuckling it, grasping the steering wheel tightly, praying that they don't die, they don't have a panic attack. So all those people are doing is rehearsing and practicing, improving their anxiety, making their anxiety worse by just practicing getting worse at it. So what you need to do is not just taking those brave steps, it's how to do it. So here are the components. You have to have an offensive mindset. You say to yourself, preferably out loud, game time, bring it on, I can handle it, right? So you're going on offense, you're actually inviting it. Then you look at the picture. Your discomfort rises, and you do the following steps. You breathe, and you respond with toughness while being clever. So any of these things will work. Give me more, I can handle it. False adrenaline alarm. I need this to be free, so keep it coming.
You know, Ken, I'm noticing that you have made some of the words bold, so I guess you were trying to make a point there.
Yeah, so in other words, when you say these things, emphasize those words. So bring it on, I can handle it, right? So I need this to be free, so keep it coming. If you say it, you know, with dispassion, it's not going to sound very good. Give me more, I can handle it. I mean, that's not very convincing. To help convince yourself, you gotta say it with some passion, right? So again, you're going to take these small steps. You're going to do the exposures until the discomfort reduces. This could take 5 minutes. This could take 20 or 30. I don't know how long it's going to take for your discomfort to reduce, but it will. It definitely will, particularly if you are doing the breathing and you're using these statements. You're going to repeat the exposure multiple times a day until it does not elicit discomfort. And then you've won your first match of this mental game, and then you move on to the next bout, your next exposure on the hierarchy, moving up towards the next level of discomfort and fear. So maintain an offensive mindset, practice daily, be patient and persistent, and play to win. So let's play. Suma, you and I will play, and everyone play along with us. All right? So what you're going to say out loud is you're going to say, game time, bring it on, I can handle it. Remember, emphasize the bring, emphasize the I. And then what I'm going to do is I'm going to show you a picture. And then once I do that, I want you to respond with one of these things and then breathe. So first respond with one of these things and then take a few breaths. We'll say 3 breaths, okay? So I'm going to be quiet while you guys are doing this. So as soon as I put up the picture, go into a response, say it out loud, and then do the breathing. So say out loud first. Let's start us off. Say, everyone, you can say along to, game time, bring it on, I can handle it.
Game time, bring it on, I can handle it. Give me more, I can handle it.
All right, now breathe. And look at the picture. Don't close your eyes. Just remember, slow and silent, slow and silent.
Wow, this picture looks pretty terrible. Where did you get it?
You can find tons of these pictures online, tons of them. Okay, let's do this again. You're going to say, game time, bring it on, I can handle it. And then I'm going to show you another picture. And again, you're going to respond with one of these sayings, and then we'll do 30 seconds of breathing slowly and silently. Go for it.
Game time, bring it on, Ken. I can handle it. I need this to be free, so keep it coming.
Right, and breathe slow and silent. Can't hear the breathing. All right, so again, you're looking at this picture, you're becoming desensitized to it. The longer you look at it, right, just keep looking at it. All right, so that's basically how you do it. Now, there's lots of different exposures, and you got to practice responding to the discomfort and uncertainty on a daily basis, one step at a time. So here are examples of lots of different exposures, and you have to decide the order of these. So, for instance, writing down and saying out loud words vomit, barf, throw up, puke, toilet art, I mean, whatever. Just write it out and just keep saying it over and over and over. Maybe you'll record it, record yourself saying it, and then play it over and over and over. And at some point, it won't bother you anymore.
So you actually have a site where you can get a lot of this kind of pictures and videos and sounds of vomiting, like ratemyvomit.com. That's interesting,
Yeah.
you know, for all our listeners.
Yeah, ratemyvomit.com shows pictures of people vomiting. You know, there's anything on the internet now, and you basically rate, I guess, how terrible it is. But there's lots of pictures there. But even if you type in people vomiting and then pull up images, you'll find plenty of, or go on YouTube. You can find videos. You can cover your toilet bowl in the rim with pea soup and just keep looking at it until it goes away. Remember breathing. Come on, bring it to me. I can handle it. You know, pretend to vomit in the toilet. Just pretend, like gag. Pretend like you're doing it. Do it every single day. Make gagging noises in a public restroom, in a stall, if you have a fear of being embarrassed. You can take a lollipop and move it to the back of your throat and actually trigger a gag response. You can spin in a chair to make yourself kind of lightheaded. So these are things you can do. Again, you're saying, all right, bring it on, give it to me, I can handle it. You're basically practicing responding to discomfort. That's what you're practicing. Responding to discomfort and uncertainty and getting tougher with it. So here are some other ones. Eat foods you've been avoiding, drink small amounts of alcohol. So if normally you don't drink at all because you're afraid you're going to throw up, you know, start with a couple sips. And then increase it a little bit. Go to places you have been avoiding. Go on a roller coaster. Go on a boat. Go around children in a playground or a doctor's office. So you typically avoid taking your kid to the pediatrician. This time you should take them. Stop washing your hands and using hand sanitizer unless you're about to eat. You know, kind of work on the compulsion of hand washing. There's also Jelly Bellies sells vomit-flavored Jelly Bellies, and you can actually get them and eat it, and it's really disgusting.
Oh, I never heard of this. Vomit-flavored Jelly Bellies. You can actually ask for it, or
yeah, you can go online and get them, and it's pretty gross. And they don't taste good at all. But again, you're learning that you can handle the discomfort, handle the uncertainty. There's also a vomit recipe you can put together, and it smells like vomit. And, I think if you type in vomit recipe, it'll probably come up online. Now start a victory journal. You know, every time you move into anxiety's territory, like you're playing a game of chess, there's a victory. Any small step in the direction of uncertainty, discomfort is a victory. Write about it. Brag about it. Put the date. Write what you did, and sign off. Hey, I'm gonna win. You can't beat me. And every day is your chance to record your victories. By doing this, by creating victories, it will motivate you to keep doing it over and over. As you see yourself gaining territory and winning, it'll keep motivating you. And then you'll get to a point where, the next step is tough. All right, I got to keep pushing on, And to do this, you got to be very motivated, because why would you put yourself through this torture unless you're motivated? So, why will you put yourself in situations that will cause discomfort and uncertainty? Why, what are you doing this for? What has emetophobia cost you? So answer these questions, write answers to these questions, and then complete the sentence. I will work incredibly hard every day because, and then complete the sentence, right? So you should actually do this, because this will help create motivation for yourself. So tomorrow's homework is to watch this webinar again, complete your motivational statement, and answer the questions on the previous slide. Identify 2 exposures you will do. In other words, 2 things you can do to create discomfort and uncertainty. And then practice responding to the discomfort and uncertainty with those, winning responses and by breathing. And then record your victories in a victory journal and keep doing it over and over and over. All right? So I want to thank everyone for joining me with this webinar. If you're still with me, great job, even though you had a fear I was going to say it a lot. I barely said the words vomit, puke, and barf. I don't even think I said those words very much. But you headed into this webinar thinking that I might say it a lot, and actually I don't think I said it very much. I should have probably, now that I think about it. But thank you so much. I appreciate it.
Yeah. Thank you, Ken. That was a very interesting presentation, and I'm sure our attendees or people who listen to it would find it very, very useful. Thank you again. So thank you everybody for participating in this webinar, and feel free to email your questions to webinars@ada.org, and please make sure to write emetophobia or fear of vomiting in the subject line. So bye for now, and we'll see you next time.
Take care.